Hello everyone, my name is Malk Assad and welcome to my YouTube channel. Through this channel, I cover different topics related to residency, the match, and conduction of research studies. In the next few episodes, we'll be covering the pathway to medical residency in Canada. In the first episode, we'll talk about the requirements for applying to the Canadian match. In the second episode, we'll talk about the match process and the interview cycle. And in the third episode, we'll go over a successful match story into internal medicine in Canada. I'm very delighted to have a dear colleague of mine, Ropin Odopashian. Me and Ropin went to the same medical school together, and through his hard work and dedication, he successfully matched at the University of Ottawa, and now he's pursuing his first year of postgraduate training. So welcome, Ropin, to the channel.
Thank you so much. Thanks for having me.
Thank you. So I will start by asking about the requirements for applying to the Canadian match. As a foreign grad coming from a school outside Canada, what do I need to apply to the Canadian match?
So there are multiple different steps. Just to mention, first, you have to have a permanent resident card or to be a citizen. You can't just come here as a visitor, like what happens in the US, and apply to the match. So you have to have some kind of permanent residency, which equals to the green card in the US, or to be a citizen. So this is the first requirement. The second requirement is writing the exams, and there are different exams that we will talk about. And the third requirement is doing observerships / or electives and getting letters of reference. So those are the three main components, speaking broadly, that will help you to submit your application to the residency program.
That's very surprising to me to know that in order to apply to the match, you need to be a permanent resident / citizen, which is a big difference from the US match.
Yeah, it's a huge difference actually, and that's why we find a huge difference also in the numbers if we compare the numbers in the US versus Canada. There are other pathways where people who are sponsored by their governments come and study here, and they continue their education. They do several years, and but I'm not really familiar with that pathway, so I really can't talk about it. But if you go to the CARM's website, which is the website for the match process, they usually require you to be a permanent resident and or Canadian citizen, and you're going to submit that into your application.
I see. That's interesting. So let's start by talking about the examinations required for applying to the match. Can you go us through the different exams that I need to do in order to apply?
Yeah, sure. There are different exams. First, it's called we have the Medical Council of Canada qualifying exam, part 1. And there is part 2, but it's not required to apply. And then you have the National Assessment Collaboration Objective Structured Clinical Exam, or the NAC-OSCE. And those are the two main exams, medical ones, that help you to apply to residency. And the third one is the IELTS exam, the International Language Testing System exam, which also is one of the required, but based on the program you apply to and based on your high school, whether it was your education, it was in English or other languages, you can do other English equivalency exams, or you can skip those. As well, as I mentioned earlier, every program have their own criteria for the language, but also to keep in mind, if you are coming from a non-English speaking country, so you have to write an English equivalency exam.
I see, but so the first two medical exams, even Canadian graduates need to take these exams before they apply?
Actually, no, the NAC-OSCE exam, it's mainly for IMGs. That means international medical graduates or the foreign medical graduates. For the MCCQE one, to be honest, I'm not that sure, but it's one of the exams that they usually write, I think, during the end of their med school, but I'm not really familiar with that.
Okay, so let's start by talking about the first medical exam. how many questions it is, how long it is, what is the materials covered during that exam, and what is the equivalent of that in the US match?
So the first exam, it's a written exam. It's the Medical Council of Canada qualifying exam. Afterwards, I'm just going to say the MCCQE Part 1. So this exam is mainly two parts. First, in the morning, you go there. You have 4 hours from 8 to 12, let's say, for example. And you have 210 MCQs, multiple choice questions, with different choices. So like, let's say you have a 25-year-old female presented with X, Y, and Z. She has the specific labs and she has the following findings on physical exam. What is the diagnosis? What is the best next step? What is the treatment? What is the management? What is the pathophysiology? So like, it's the part one is more similar to the step 2 CK in the US. The second part, which you write it in the afternoon, it's 38 cases, and there are different. So I think it was like around 7 cases. It was, yeah, I think it was, yeah, it was 38 cases, and it's around 3.5 hours, and you have multiple questions on each case. So they mainly present you with a case, and they present you with different choices. So for an example, you have like a 65-year-old male who presents with shortness of breath that gets worse during lying flat. They present something, let's say, similar to heart failure, and they say which one of the following tests you will order, and they present like 20 tests, and you're going to choose 2 or 3 or 4 based on the STEAM and based on the clinical case you are seeing. So the second part is called the clinical decision making part, because you are making clinical decision. It's similar more to real life. Well, you have all the exams in the hospital, but you have to choose which one to order, which imaging test to order, and which question to ask to become more efficient. It's more similar to the USMLE Step 3 exam, the second part of the USMLE Step 3, where also like both exams have some similarities. So those are the main two parts. Just to mention that the MCQ part, it has some pilot questions, and the clinical decision making, the CDM part, also has some pilot question, something to keep in the background of our mind when we are taking the test. And I think that's it. If we talk about the exam broadly, then we go to the topics. So they usually cover different aspects of medicine, internal medicine, OBGYN, pediatrics. But over the years, I heard that there is a lot of emphasis on the ethics and what would you do in different situations, and how would you judge. And they usually like ask you, they present you, take more like an ethical scenario and ask you, what would you do, and or what would you say. Here in Canada, we really like make sure to ask more like ethical questions and see how would you act in different situations and how you treat patients, which is like there's a lot of emphasis on that part, as I'm going to speak as well about the NAC OSCE exam.
That's interesting. So from what I understand, the first half of the exam is more of MCQ questions. You have one choice per question, but the second half is more of clinical scenario where you can choose multiple questions, multiple answers, and it
Correct.
goes through the case through multiple steps of the diagnosis,
Yes.
treatment.
Correct.
What is the average of the scores? How many questions are there, and what is the full score? What is the minimum score? What is the pass score? All this kind of information.
That's a good question, actually. During the recent years, we've seen a huge change in the exam system here in Canada. So now, at this point, the scoring system ranges from 100 to 400 points, and the passing score is 226. The mean is 250 with a standard deviation of 30. Just like obviously as high as you score, the better chances you will have in the future in your application. But this is something that we will talk about in the next episodes.
That's interesting. What about the second exam? Can you please go through the second exam? What does it cover and the scores?
Mhm. Yeah, so the second exam, it's a National Assessment Collaboration Exam, the NAC-OSCE, which really is one of the exams that has a huge part in the scale here in Canada. So it's similar to the CS in a way where you are doing physical exam, but it's heavier. The content of the exam is slightly trickier. You have to do more things in a shorter period of time. So speaking broadly, it's mainly like you have 12 stations where you have in each station a standardized patient and an examiner in the room. So you go, you see an examiner sitting in the room, and also you see a patient, which is different from the CS exam in the US, where you go to the room and you only see the patient.
Yeah, that's
So that's a huge difference, which some people might find it really like stressful to be under spot and to be questioned. This is one of the differences, and each stations, 2 are pilot and 10 are scored. Each station is around 11 minutes, and you have different types of stations. So you might be asked in the next 8 minutes, please take history and do a physical exam. And there will be post-encounter questions. So you go there, you have 8 minutes, you take history, you do focused physical exam. At 8 minutes, the bell will ring. You have 3 minutes with the examiner directly asking you specific questions about the case. For example, what's your diagnosis, what's your management, what do you think is going on? And you're going to take the examiner through your thinking process and you're going to answer him. Uh, this is one of the types of the station. The second type of station, it could be please in the next 8 minutes take history, and there will be post-encounter questions. So 8 minutes you take history, 3 minutes post-encounter question with the examiner. The third type of stations are the counseling stations, where like in the next 8 minutes you have a patient presented with X problem, and please go and counsel the patient, where you just go and you counsel the patient. The examiner will score you based on your interaction with the patient. There might be or might not be post-encounter questions. But when you finish at 11 minutes, you leave the room. Unlike the CS, you don't go to a computer and you type in a note. You don't do that here. You just move on to the next station, which is one of the differences that we see when compared to the US. You just, in the US, like you have 15 minutes, you leave the room, 10 minutes to write the notes. No. Here, like you have 11 minutes with the patient and the examiner, and where they test your interaction with the patient, and they test your language skills, your eye contact, and many different aspects, and how you examine the patients, and how you are able to answer the questions and synthesize the clinical information that are given to you during the encounter. So this is one of the differences that we see. The second difference is the emphasis and the huge scale, the huge part of the exam in the scale. So the NAC-OSCE exam is one of the most important exams for people applying for medical residency here in Canada. Uh, Here in Canada, there is a huge emphasis on how we interact with the patients and what kind of focused physical exam we do and what kind of questions we ask. Uh, I feel like this is slightly different when compared to the practice in the US, where it's you can order more exams and you can, or in real life I'm talking, you can order more tests and more exams. Here we like to do more focus history and focus test, and to use resources more efficiently and like being wise. I'm not saying like in the US it's not synthesized in like non-wise situation, but like here, because like we don't have insurance companies and we have like one pair in the system. So they like you to be really focused in your history and in your physical and your labs.
I see. So the two main differences is that the Canadian one is scored, unlike the
Mhm.
one, which is pass or fail. The human
Yes,
is placed on the Canadian one, while in the US, if you pass, that's fine. If not, that's
correct.
no problem, but you just pass. So there's a big difference in that aspect.
Yes,
The second
yes,
aspect is writing the exam note after you leave the room. You in the US one, you have
correct.
minutes. You just write what you found, differential and treatment plan. But in the Canadian one, you talk to an examiner.
Exactly. You're being tested in the room.
I see. What is the average score for that exam, and what is the passing rate?
hmm Actually, it's changed in the last year. So now the score ranges, I think, between 200 to 500. I'm not sure about the passing and the mean score, but as I remember, it was around like 390s for the passing. And then like you have the median, I think it was 425. And like the complete 100 percentile score is like the 500.
Wow, that's pretty high. The median is kind of close to the full score.
Yeah, yeah, actually.
I wanted to ask you if there are available materials that is kind of considered the gold standard for preparing for these two exams. You know, in the US, they have the first aid for step one, UOL
Yeah.
also for step two, they have UOL again. For CS, they have some various resources also
Mhm.
in other books. Are there available resources for these two exams in Canada?
There are resources available here in exam, but different people use different resources. I feel like in the US, like it's more well, people usually agree like you have the first aid, like this is a bible, like it should be written in the for the, let's say, the step one, and for the step two, like you have the u word, like this should be done like 100%. Here in Canada it's not like that. Different people have different resources. Some people use Toronto notes, some people use different question banks. uh, Other people might take private courses. It depends on the exam and it depends on the available resources. Also, if you go to the Medical Council of Canada, they have also resources in their web page. But like this is a completely like a different topic, and like this requires a one episode by itself. But yes, there are resources, and but it's different. It's variable when compared to the US.
I see. We'll go over the resources you studied in our
Sure.
experience,
Yeah, that would be my pleasure.
dedicate specific episodes for the resources for each exam.
Yeah, yeah, that would be helpful.
So what about the other exams other than the NAC OSCE and the MCCQE one?
So the third exam, it's the language. So if you, let's say you done your medical training or like your medical school in Europe or like in a place where you were taught medicine in English, so you don't need to write an English equivalency exam. But let's say, like, for example, my situation, I did my med school in Syria, in Aleppo, and we are taught in Arabic. So I had to write an English equivalency exam. I had to write the IELTS, but like there are based on the programs, based on the province, there are different criteria for accepted exams. And some people who they might do their medical training in non-English university, but they studied high school in English and they were here for high school or undergrad. So they can say that to the program and they can submit a document certifying that they did their undergrad or high school in English, so they don't need to write the equivalence exam. So speaking broadly, the general exams are the MCCQE1, the NAC OSCE, and the plus or minus the English test. But sorry, I'm interrupting you, but like this is a point I feel like it's important to mention. We have also province-specific exams, where like for an example, the province of British Columbia, they have like the CAP exam, the clinical assessment program, I think. Alberta have their own exam. Sometimes some programs in a specific province may ask you to write specific exams, like one of them is called the Casper exam, where it's more like an ethical exam. So you have to read between the line. You have to read, actually. You don't have to read between the lines. Sorry for that. Like, you have to read each program, what exams they are asking you to write.
I see. So that makes the process even more complicated to have a specific exam for each program.
Yeah, it is.
And is it correct if I say that the topics covered by these various exams related to each province or program are similar to the MCC QE1, the step 2 CK/step 3?
And are we talking about the specific exams?
The ones that are related to each province and each program.
It depends, actually. So, like, when I was applying to residency, when I applied, I went to Vancouver and I wrote like the CAP exam, and it was really like a medical exam. It was, but it was in a sense different, where like we had an examiner and the examiner asked us clinical questions and they tested our thinking process. So like there wasn't a patient in a room. It was like 12 stations. You go and you meet an examiner and they test you
So it's
for like,
exam.
yeah, it was medical.
Oh, but it's not written.
It wasn't written, it was oral.
Wow.
But on the other hand, I also like wrote the Casper exam. I believe it was for like applying for the province, applying to Manitoba. And it was really more ethical and even non-medical. They present you with cases like an ethical dilemma that might happen in life. One of your friends need help, and like you have money or you don't have money, or like your friend have a problem in it's more like an ethical issue that you face in real life, and it's not medical, and they test your ethical judgment.
That's interesting because, as you know, residents encounter these kind of situations because they're residing in the hospital, and you have to deal sometimes with situations that are not medical. So I think it makes sense to test these kind of abilities.
Yes, it is actually.
I wanted to ask you, is there a limit for the IELTS through the different writing, speaking, listening, and reading?
Yes, actually, they require like to score 777 reading, writing, and speaking. But I'm not sure if like, I think it's seven, like it's unified the score across Canada for the IELTS.
I see. And I assume for the French-speaking provinces, they require French examination.
Actually, yes. So for French-speaking provinces, they have their uh, French test exam. I think for University of McGill, they have a specific program or specific way where you apply to the university outside of CARMS, where you don't need to write a French language test. But I don't really have enough details about that.
So the bottom line is that you have to check almost every single program and check their
Correct. Exactly. You have to check every program, every province.
Okay, so that wraps up the examination part. I just want to touch lightly on the other requirements for the match. Here in the US, if you apply, there are other factors that can help your application but are not required. For example, research, clinical experience in the but there are things that are required. You need to have 3 letters of recommendation from someone, from a doctor, from a physician,
Correct.
for you to apply to a program. Preferably, this should be from somebody in the US, but you can get them from somewhere else. Are there a specific number for the number of letters or the clinical experience in Canada or not?
Actually, yes, that's also like one of the requirements to apply. It's one of the mandatory things that you have to have like some sort of Canadian experience to do like an observership/elective in a university or in a clinic, and to get letter of reference. They usually they might accept, like I've heard in some cases where they accepted like a letter of reference from outside Canada, but of course it's always preferred to have a Canadian experience, student from Canadian physicians. Usually they ask for 3, but also it depends on the program. Some programs might ask for 4. but in general, broadly speaking, it's 3. And if you submit a 4, they might not even look at it. So letters of reference are important as well. You could get them through observerships or elective. Like this is also another topic that we can talk about. And the last thing, it's the extracurricular things. Like they are not required, but of course, like they will boost your application and they will make you shine among other candidates, like research, volunteering in the community, leadership roles, uh, uh, making a difference in the place where you live, having interesting background story. So those are small, minor things that help to boost the overall application, but they are not mandatory.
I see. I agree with you that these are very important aspects of your application because it
Mhm.
apart from the hundreds of other applicants.
Correct, yeah.
So in summary, I understand that there are 2 required medical exams. The language depends on where you went for high school or college, how you studied medicine, and the various specific examinations for each state or for each province, sorry, and each program.
Correct, yes.
I have 3 letters of recommendation with some clinical experience in Canada.
Yes.
Thank you so much, Chopin. It was a pleasure talking to you.
Thank you so much. I appreciate it having me.
That wraps up our discussion for the first episode. In the next episode, we'll talk about the match process, how each of the factors we talked about play a role in getting you a residency. So thank you so much for watching. If you like this episode, please subscribe to my channel and follow me on Instagram and Twitter. See you in the next episode.
Thanks for having me.